Have you ever had morning breath so bad that even your coffee seemed offended? Or maybe you've had that awkward moment where you're talking to somebody and you suddenly wonder, can they smell my breath? Here's the uncomfortable truth. Most oral problems like gingivitis, bad breath, tongue cracks, and oral sores don't start in your teeth or in your gums, but they actually begin in your oral microbiome and gut imbalance. And brushing alone will not fix that. Hi, everyone. This is Dr. Neha Garg here, an integrative nephrologist and an Ayurvedic health counselor. Today, we are talking about two ancient Ayurvedic habits that take less than 5 minutes but may completely transform your oral health. Let's dive in. First is tongue scraping, also called Jiva Nirlekhana. This is the simplest and most underrated habit. Many people brush their teeth twice a day, but never clean their tongue. Have you ever noticed that white or yellowish coating on your tongue in the morning? Ayurveda calls it ama or toxic metabolic residue. Modern science calls it bacterial biofilm, a coating made up of bacteria, dead cells, food particles, and inflammatory compounds. This is one of the most common causes of bad breath. Brushing your teeth is like mopping the floor but leaving the trash untouched. Without tongue scraping, you are literally re-swallowing the toxins and the bacteria every morning. Tongue scraping reduces bad breath significantly. It improves taste perception, which then improves digestive enzyme signaling. For those with gum disease or chronic tonsillitis, this reduces the overall bacterial load. And for those with SIBO or small intestinal bacterial overgrowth, this can be a slow but an effective way to reduce some of the chronic symptoms. Technique is simple. Use a copper tongue scraper with 5 to 7 gentle strokes over your tongue every morning. Copper has an antibacterial effect of its own, and it is better than a stainless steel scraper. If you don't want to use a tongue scraper, you can also use an end of a tablespoon to do this. Think of this 1 minute practice as your first line defense against oral dysbiosis. Second practice is oil pulling, also called kavala or gandusha. Oil pulling is Ayurveda's most powerful detox rituals. Take 1 tablespoon of coconut or sesame oil and swish it in your mouth for 5 to 10 minutes. And then you spit it out. The science is fascinating. Oil acts like a lipid magnet that binds bacteria and bacterial toxins. Coconut oil contains lauric acid, which has an antimicrobial effect and reduces Streptococcus mutans, the cavity-causing bacteria. Conditions where oil pulling really shines is gingivitis with bleeding gums or inflammation, plaque buildup with early cavities, chronic bad breath, dry mouth with cracked lips, and it also improves voice clarity and taste. Studies show that oil pulling can reduce plaque and gingivitis similar to medicated mouthwashes but without chemical exposure. Per Ayurveda, oil pulling balances kapha or sticky residue buildup and nourishes oral tissues. If not daily, you can do oil pulling 2 or 3 times in a week. One word of caution is for those with oral thrush or fungal infection of the mouth. Oil can act as a medium for spread of that oral fungus. So those on immunosuppression or chemotherapy with oral thrush should avoid oil pulling. If you want a simple Ayurvedic oral detox routine, here it is. Step number 1, scrape your tongue. Step number 2, do oil pulling for 5 to 7 minutes. And step 3, brush and floss normally. That's it. Just a few minutes each morning, small habit, big payoff. In the next video, we will explore 3 powerful Ayurvedic herbal mouthwashes that you can prepare at home for bleeding gums, tooth pain, mouth ulcers, and oral inflammation. If you found this helpful, please hit that like button and share it with someone who skips tongue scraping. Follow Healthy Buddha for more topics where ancient Ayurvedic wisdom meets modern science. Till next time, stay healthy, stay mindful, stay smiling.